Okay, so welcome to Voices in Health and Wellness, where we speak with passionate leaders transforming care in their communities. Today, we're joined by Brooke Buck, a licensed psychotherapist, an ADHD certified clinical services provider, and the founder of Cloudbreak Therapy and Cloudbreak Kids, two practices based in Alexandria, Virginia, that provide trauma-informed care across multiple sites. Brooke's clinics are known for their focus on neurodiverse clients and innovative approaches to accessibility in behavioral health. We're going to explore real-world challenges facing small private practices today, from clinic burnout, clinician burnout and access issues to rising expectations from clients and everything in between. So thank you very much, Brooke, for joining us. And you're calling from Alexandria today, I believe. Is that right?
Yes, Alexandria, Virginia, and we're right outside of the Washington, D.C. metro area.
Wonderful. Could you perhaps start by telling us a little bit about what you've built in terms of Cloudbreak Therapy and Cloud Kids and what your sort of current role is within these clinic settings?
Sure. Actually, next month, we're going to be celebrating our 10th birthday for Cloudbreak Therapy. I started it in 2015, and it was just me as a solo practitioner. Prior to this, I had been part of a group practice, and I decided that I was ready and had the knowledge and training to go out on my own. So I started it, and then all of a sudden, unbeknownst to me, it started to grow, and more clinicians came aboard. We had to then hire administrative assistants to be able to help us manage taking insurance, the billing, all the things behind the scenes. Now we are 14 individuals, and we also, one of those individuals is a psychiatric mental health nurse practitioner we have on staff to help with medication management. Other therapists range from residents, so they are getting their hours. It's kind of like a postdoc in our kind of mental health world for counseling. They're getting their hours to be able to get state licensed. We have some residents, and we also have LPCs and also licensed clinical social workers, LCSWs as well. And they see a variety of different populations, everything from children through adulthood. We also see families as well as couples.
Amazing. And what's your sort of current role in the business? I mean, in terms of whether it's sort of clinical or leadership, admin, or a bit of all of the above, how do you spend your time?
Honestly, a bit of the all above. I rarely work less than 40 hours a week. I do have my client caseload that I refuse to give up because seeing people and making a difference means so much to me. I do administrative things on the side, not as much because I do have assistants, and I do supervise. I am also a supervisor in the state of Virginia and other areas as well. And so I do help train the next therapists that we're going to go out into the field and see people as well. So I've trained about 8 or 9 people to this point over the past 10 years.
Amazing. So you're a multi-state provider. You've got the clinics everywhere. What are the big changes that you're seeing in mental health care today from your perspective?
Yes, given that we're in the Washington, D.C. metro area, it's kind of hard to just be licensed in one spot because they're so close. So yes, Washington, D.C., Maryland, and Virginia. What we're really seeing, we do see clinical burnout, and I do experience that with our staff. You know, is it the heaviness of what the individuals coming to us are going through? When you talk about trauma work, it can definitely be a lot. And for that therapist to be in a good mental headspace themselves to be able to work with the individual. So we are definitely seeing that. Boundaries sometimes can be a concern given the modern technology we have today. People do text. People do send emails after hours. And if therapists don't have good set boundaries, it can be difficult, leading to quicker burnout. So we really, really encourage our therapists and our team to make sure that they are taking care of themselves. They are scheduling time off. They're setting boundaries with when they won't look at any more text or emails, when they are needing a vacation, some time off, and really being able to detach, making sure that they have good things outside of they're seeing their clients, hobbies, exercise, what are they doing to take care of themselves? So we really try to focus on that. We are seeing an intake and some clinical burnout. We are doing everything we can to address it to make sure the provider can not only show up for their clients, but also show up for themselves.
Excellent. I'm guessing this is not unique to your particular practice. I guess this is a niche-wide problem.
Yes. There are, there's think about the rural areas. There's not a whole lot of providers. So those providers are having a hard time. And then even in the DC metro area, there's so many practices. At the same time, it is still a lot of people coming in, wanting services, needing services. So trying to find that balance of how many is just the right caseload number and where can I take more clients on? Do I offer telehealth for someone in rural Virginia because they can't find an in-person provider? And trying to balance all that can be quite a bit. So I definitely work with the team to talk about that. We have group supervision. I have individual supervision with everyone that is needing that right now. And we talk a lot about that, how to make sure we take care of ourselves, which is so important. And sometimes it's just the peer-to-peer support can be helpful. Like, I'm not the only one experiencing this.
Of course. I mean, do you think your approach has made an impact on the clinical burnout? It's certainly in your practices, having this sort of more caring approach and being mindful of the kind of contributory factors that lead to it. Do you think you're making a dent in this, if it's an industry-wide problem?
Trying our best to make a dent in it every which way we can. The more we can educate ourselves about it, the more we can stop trying to, I tell this to every person that works with me, we can't fix anyone. We can give them the tools, work with giving them insight, helping them see patterns that they're developing that are healthy or not healthy. We can't fix something. So one thing is people really struggle with in this field is the imposter syndrome, and that I need to do it. I need to fix it. I need to if I just knew one more thing, I could help this person. And that is a big struggle we are also seeing, and just trying to reiterate, you're here to help. And what does helping look like? It's so many different facets to helping someone. It doesn't mean taking care of it for them.
Got it. COVID, I mean, it seems like a long time ago, and yet it seems like yesterday, but how did that kind of shape the way that you run your services? I guess, like many practices, you had to shift to an online model. I don't know. And I don't know how much of that has kind of carried on since the whole lockdowns disappeared, but how did that whole shift your practice and the way that you do things?
It was very interesting how quickly it happened. I had just had my third child, just come back from maternity leave, and then everything happens and everything starts to shut down. So we easily pivoted, thank goodness, because that's why we have such a great administrative assistant. We actually call her a creative director because she does everything behind the scenes for us. So blessed to have her with us. She was able to get everything kind of easy to go. We used to use a system at first called DoxyMe that was HIPAA approved. That seemed to go really well. We started to hire more therapists because we saw an uptick, very much so, and people needing services within our community. We actually hired some therapists, some of which, were completely remote, and I didn't meet them for a year because of the lockdown and everything. So we were able to pivot. It was hard as a parent and business owner to be able to figure out how to work from home because we weren't having clients in person. So that was a big shift for people, making sure you have a safe environment that's also private and quiet as much as you can possibly do. So we saw a lot during COVID, very much an uptick in people wanting services. We also hired several people during that time. So I think we were very lucky to weather it fairly well.
And several years down the line, you still have a sort of a hybrid approach? Now that we can still see people in person, we can see people in person these days, but I just wonder whether the demand for online services has kind of stayed, and people want to have care delivered in that way, even after lockdown finished.
Yes, most of our therapists do some sort of hybrid approach. We do have several that are completely telehealth, given where they are located. So we are seeing very much a trend of more and more people wanting to be in person. And I've owned a lot of Facebook, different groups for LPCs, therapists in general, Virginia-based, around the U.S., world-based. And they have also, the comments I've read a lot recently, they have also seen an uptick of people wanting in-person services again. So it's very much both. But someone that started services with us living in possibly a rural area, they're going to probably most likely stay telehealth just because they don't want to have to then commute. And we wouldn't require that of any of our clients if they don't want to. It depends on the day. With so many people going back into the office, we are seeing it becoming a little more difficult for scheduling purposes. So I'm really working with the team to be flexible with those individuals. while they are employed.
And what's the dynamic like? I mean, obviously the nature of the work that you do, and it's really intense and trauma focused stuff. How does that dynamic change, in the remote setting versus in person? And how do your team show up for both? I mean, how do they show up for somebody who's online, where you kind of lose a little bit of that connection versus in person?
We try our best to make sure we're building rapport with our clients. We're open with our clients. Is this working for you? Is this not working for you? Do you need, instead of a telehealth provider, do you need an in-person provider? And sometimes, depending on what they're going through and their level of care, their level of need, they do need to see someone in person. For example, the younger aged individuals, children, teenagers even, we really prefer to see them in person because that's so much more impactful, like you were talking about. Some people actually prefer telehealth as adults. Mm-hmm. So it really just varies the personal preference. So we try to be flexible with everyone. We do with medication management, especially if someone needs to be higher level of care, needs to be seen a lot more regularly. We do encourage in-person services. And the younger they are, we do encourage in-person services just to make sure it's the best fit for everyone.
So what's going really well for you and your team at the moment in the practices? What's something you're kind of really proud of that you've managed to do?
We're really proud of. We were just awarded the best counseling therapy practice for Northern Virginia by Virginia Living Magazine. So we're very, very proud of that. So we kind of feel like we're doing something right. So we were voted that, and then it just came out this month.
And what is it you think that you do over and above perhaps what other people in the space are doing? What do you think was the thing that made you win the award? What was the thing?
Well, I think hopefully we're providing good services, and people want to continue working with us, and we are able to retain our clients that are still needing services, that they feel that they have a rapport with us. We have built that connection, and that's really important. Because when someone comes to therapy, they're probably not in the best headspace, unfortunately, because they don't come to see us because they're doing really great. So we kind of have to take a step back and be like, they're coming for services, they're coming for support. And what can we do to make sure we are doing what we need to build that rapport, to help them, to break things down with them, and involve them in their treatment process. We do treatment plans with our clients, so they know their goals just like we know their goals. So they're not coming in every session and saying, okay, well, I did this week and this happened over the weekend. We're trying to make sure we tie it to those goals every session, at least one of them. And this goes for all ages.
Brilliant. What part of running a multi-state practice has surprised you the most? Obviously, you've been doing this for a while, but what's the things that surprise you about this whole operation?
It's a lot of juggling. The bigger it gets, it can be a lot to manage and a lot to support. So we only have one physical location, but we are seeing clients in a variety of different areas and different states. So it's just continuing to make sure I check in with myself. Where are we at? What does the practice need? Do we need to shift? For example, our creative director is now finishing up graduate school to be a therapist. So we're definitely going to have to be shifting. Do we outsource things now? Do I take more on administratively? And where do we balance? Because we are an insurance-based practice. Mm-hmm. Unfortunately, we're a dying breed being insurance-based practice.
Got it. And how do you maintain that sort of consistent culture across locations? Like you said, you've got one physical location, lots of means of patients accessing your colleagues. But how do you kind of maintain the culture across your business?
Culture with the team?
Yeah.
Actually, we try to do virtual team building exercises and events. We actually have one coming up, not this Friday, but next Friday. We're doing a murder mystery virtual experience. So we try to do those to continue to build team morale, check in with each other. We have monthly meetings. We have lunch and learns to make sure that we're continuing learning and engaging and that we have that connection with each other. Also with the group supervision and individual supervisions, or so with the group, we were able to come together, collaborate. I'm struggling here. I had a win here. This person had a breakthrough. I'm so proud of them. So we're trying really hard to make sure no one's feel like they're isolated on a little island.
Got it. You talked about your award, which is amazing. Well done. But on the sort of flip side, what's sort of being hard or challenging in the business? What things are operationally cause you sleepless nights or things that you worry about?
Insurance. Insurance. Being an insurance-based practice, that we do accept several different insurances, and we've added throughout the years. There are some insurance companies that are really wonderful to work with, who are reasonable with their rate increases for us annually, or if we do a value proposal once a year and send it requesting a raise, they really take that into consideration and they work with us. And then we have the insurance companies who refuse. That they won't change their rate. They haven't increased their rate in 8 years. So actually we're taking about a 30% pay cut from that insurance company.
Wow.
And they are a dominating factor on the East Coast. So we are constantly trying to see what we can do to make things work. We will take insurance. We will always accept insurance, but that can be a big barrier. The insurance companies denying claims, the insurance companies not increasing any of our rates, because it's kind of like how I describe it to people. Imagine the insurance company is your boss. Mm-hmm. So we are, as practitioners, going to our boss, the insurance company, saying, hey, look, we've done all these great things and served the community. We would like this. We would like a raise. And they just either ignore us or say, no, we're not making enough money.
It's funny because I'm UK based. We don't really have this kind of thing going on quite so much in the UK. We have a health service where everything is free at the point of delivery for patients in the service. But everyone I talk to in the US, the insurance thing is always crops up on these calls. It's really, really interesting. I mean, how do you navigate this? I mean, have you found solutions to kind of work around all these different things? Because you've mentioned some nightmare things in terms of things that affect your income as a practice. How do you kind of get around all of this?
We try our best to increase our referrals with the other insurance companies as much as we can. We file complaints to get the insurance company that I was speaking about, that unfortunately I will not name. We try our best to see what we can and can't do. We try to cut our costs in other areas. We try our best to make sure we're aware of it, and we're not going to just go away. We're going to keep doing the value proposals. We're going to keep filing the complaints. We're going to keep doing what we need to do to make sure that we're trying to change. What happens with a lot of practices, and several that I know of personally, that I have colleagues, friends that own practices, they've just said, no, I'm not dealing with it. So then they go self-pay. And a lot of people can't afford self-pay. And I know, being in the Washington, D.C. area, there are a lot of high-paying jobs, highly educated individuals, but that doesn't represent the whole population. There are a lot of people who can't. And unfortunately, with the political climate that we're in, more and more people need to be able to use their insurance, or be able to have a lower sliding scale rate because they've unfortunately have lost their jobs or gotten laid off or rift.
Got it. Have you noticed anything in terms of client expectations that you see coming through, and how has your practice sort of managed to adapt for what you're seeing and what people are asking for?
Client expectations, making sure that you have in-person availability. They want to be scheduled fairly soon, especially because they have something probably going on right then and there. So we try to get people in as quickly as we can, not having them wait months. At some points, we've had to unfortunately do that, trying to make sure we offer different services for the client's expectations, everything from like the medication management side to maybe a provider that sees young children as young as 3. So we try to make sure we're offering those services that we're seeing people want and request in the area. We've also started to offer groups. We've done a parenting group. We've also done a women's empowerment group that people have really taken hold of and really seem to like that. We also have, every once in a while, we'll survey our clients, our population that we have right now that we're serving, and like, what are you looking for? What would you like to see? What is the most important thing to you right now as far as for mental health and therapy? So we do that as well. That way we can get some feedback from them, so we kind of know, do we need to pivot and turn somewhere else?
Interesting. And on that point, are there any sort of services that families are asking for now that they weren't sort of 2 to 3 years ago?
ADHD and autism are definitely coming up more and more. It wasn't that it didn't exist prior. People are questioning, they're asking, and we're seeing links, and we're like, okay, well, we might need to consider getting tested. And we also see that in adults. So we are seeing a big push from families. It's like, what is going on with my child? Is it anxiety, or is it something such as ADHD that, is creating that anxiety for that person?
Got it.
We are seeing a lot more diagnoses in autism and autism spectrum, ADHD, and the neurodivergent population.
Is there certainly in the UK, the wait time to get an assessment in the health service is around 2 to 3 years. I mean, do you have anything like that level of burden in the US, or because of because there are more practices doing what you do, is that something that you can service?
We don't necessarily do as much testing in-house. Mm-hmm. We are constantly networking. I have a networking event Friday with other therapists. And oftentimes when I go to these networking events, I will meet individuals who just started a practice with medication management. So we can refer people there and they can do testing, or we don't necessarily, there might be something that we don't necessarily do. So I'm constantly linking up with people in the community, other therapists, other practices. What do we need to do to collaborate? Because we want someone to feel if they come to us, even if we can't necessarily support them at the moment, that we can try to link them up with someone who can. So these networking events are so important to go to in our community to make sure that if we can't support someone, we can figure out who can. And I have my nice little book of business cards with everyone in there so I can flip through.
Great. Are there any, in terms of you managing this as a business, are there any particular metrics or things that you look out for to kind of gauge how well you're doing, the kind of things that you focus on as a business owner?
I just want to make sure my staff is happy. So if they're happy and I can give them the rate increases annually that I would like to, I consider the business doing good. So at the end of the day, I just want to make sure we have a little bit of reserve in the bank accounts. I just want to make sure the staff is happy, make sure that they are feeling seen and heard, checking on them with their mental health. Do they feel we do live in a very pricey area, making sure that they feel that they can afford the things that they need to be able to have a place to live, eat, all those things. So at the beginning of the year, I did ask everybody, I was like, how are you feeling about what you earned last year? What would you like to see this year? Let's talk about if it's doable. What would put you in a good position financially?
Brilliant. And then thinking about the future, so thinking about the next sort of 6 to 12 months, what are you hoping to build or evolve within the practice?
Well, actually, Cloudbreak Therapy is partnering with TheraGrace, and that is a 501c3 mental health nonprofit that I've started that's going to start with the funding. We're fundraising right now to be able to fund people who can't afford therapy services. So we're going to really try to balance the two of those so that we can start to, for a lot of people who have lost their jobs, having other financial hardships, that they will still be able to get services, because we'll find a balance between practices in the area for their providers to see individuals. We'll offer a kind of a scholarship program that will help with the payment of therapy for individuals for X amount of time. So we're in the process of fundraising, working with the board, getting everything kind of up and established.
Brilliant. I was going to ask you if you could wave a magic wand and solve one issue, what would it be? I think the answer is going to be the insurance. Is there anything else though that is like a sort of a block in what you try to do for your patients? You hit the nail on the head. Insurance, I wish the insurance would accept mental health as much as they do physical health in the United States, and work with us to make sure we're paid a reasonable rate for our areas. I would love that to be more accessible for people, and basically making sure that if someone wants services, they don't have barriers to get services. We want to make sure that they feel that I live in this area, there's no therapist, I can't get services. We want to work with those individuals. Yes, you can. What's your barrier? Is it finances? Is it your location? What is going on that you aren't able to get services? And also reducing that mental health stigma that therapy is not helpful. It's not helpful to kind of work on yourself. It can be very generational at times. Brilliant. Brooke, thank you so much for spending the time talking to us today about you, your business, what you've achieved, what you've built. Really, really interesting to hear. Really interesting to hear about the whole burnout thing and how you look after your staff. and also to hear about the common stumbling block of the insurance, which seems to be a universal US theme that I'm hearing on these calls. But it's interesting because we're all trying to learn from each other as practitioners, and it's useful to know what challenges that other people have in different parts of the world in different space. But thank you so much for your time today. Really appreciate your openness and giving us a sort of candid insight into your clinic.
Great. Thank you so much.
Thank you. Yes.